Vaping products haven't been around very long, and yet the devices are everywhere. And lately, so are headlines like this.
Today, urging people to avoid vaping THC products after a 13th person died.
Not long ago, vaping was touted as a smoker's savior, a product that would finally bring an end to the scourge of cigarettes. But now, all of a sudden, the word vaping is toxic, the subject of an epidemic and public health crisis.
The federal government today warned Americans not to use e-cigarettes following several mysterious deaths linked to vaping.
India, Brazil, and Thailand have joined a fast-growing list of jurisdictions that have now banned the sale of electronic or e-cigarettes. But are these warnings and bans really necessary, or a knee-jerk reaction?
Cigarettes are pretty much the same. When you talk about cigarettes and their harms, there isn't much difference from one brand to another. But e-cigarettes come in various shapes and sizes. They use liquids and cartridges that contain different chemicals, different flavorings, different nicotine concentrations.
There are a ton of vaping devices on the market, but the most popular are vape pens. They're easy to use, and most work by heating a liquid that contains either nicotine or THC. That's the psychoactive ingredient in cannabis that makes you high. Many of the cartridges also contain flavorings and other chemicals that combine to produce an aerosol.
I think there's a lot of confusion. The word vape and vaping is an industry term. It connotes vapor and water vapor, and a lot of people think that's what it is, but it isn't.
Now, unlike a water vapor, which is harmless, the aerosol contains tiny particles, chemicals, and organic compounds, such as benzene, which is found in car exhausts, and cinnamaldehyde, which produces a cinnamon flavor, but has also been known to impair the ability of the lungs to get rid of mucus.
It's actually inhaling what are likely very dangerous things into your lungs, and your respiratory system was not designed to inhale smoke or to inhale aerosol. So we don't know for certain what the long-term dangers are if you are to vape on a regular basis for the long term.
But we are learning what the dangers are in the short term.
More and more concerns this morning about e-cigarettes and vaping. A patient died from a severe respiratory illness, and it could be the country's first vaping-related death.
There have been thousands of reported cases of what health officials call vaping-associated illnesses. Symptoms include shortness of breath, cough, chest pain, vomiting, and fever. Dozens have died. Their ages range from 75 to as young as 17. In the United States, the Centers for Disease Control and Prevention recently announced that they may have found a culprit, vitamin E acetate, which has traditionally been used in supplements or skin cream. It was recently added to some vaping cartridges to make the THC oil appear thicker and go further.
But of course, when you inhale oil, it's very, very difficult for the body to get rid of it. So this is part of the issue that we're seeing with, we believe that we're seeing with these illicit cartridges.
Fortunately, most vaping devices do not contain vitamin E, particularly those purchased from legitimate retailers, a fact the vaping industry has been very keen to stress.
So no commercial nicotine-containing electronic cigarette contains vitamin E. They don't need to. They have glycerin, they have propylene glycol, they have water in them. There is no need and no function that vitamin E plays in a commercial e-cigarette.
So that's it. Vaping vitamin E is evil. Mystery solved, case closed, right? Well, not exactly.
There is a danger to simply blaming everything on THC vaping with vitamin E acetate in the liquid. While that may be a good part of the explanation, it's absolutely not the whole story.
The whole story is more complicated. Most of the serious illnesses have involved people who vaped THC with vitamin E acetate, but others got sick after smoking both THC and e-cigarettes, while some only smoked nicotine e-cigarettes without vitamin E.
I would say that it is still somewhat of a mystery. Also need to take into account that it's already been several years that millions of people around the world have been vaping. And yeah, it's alarming that some 2,000 people have become quite sick and tens of people have actually died. We don't understand it completely, and I would say stay tuned.
And that's the key. While there have been a relatively small number of illnesses from short-term vaping, it's the long-term consequences that are both unknown and unsettling.
Really, the big fear is in what's going to happen long-term, and the early suggestions of especially respiratory disease are quite alarming.
The first long-term study on e-cigarettes tracked the tobacco habits of around 32,000 Americans over a 3-year period. Now, it found that e-cigarettes increased the chances of developing chronic lung disease by about a third. The study also found that the vast majority of traditional cigarette smokers who then tried e-cigarettes ended up using both, and their risk of developing lung disease more than tripled. The long-term effects of vaping are particularly troubling because the number of young vapers is rising fast. One study from the University of Waterloo found that the rate of teenage vaping in Canada nearly doubled in a single year, jumping from 8 to 14%. One of the world's largest e-cigarette makers, which owns Juul Labs, is now facing a slew of lawsuits and investigations over allegations that it deliberately marketed and sold its flavored nicotine products to teenagers.
I'm really concerned, and I have kids of that age, and they've got friends who are heavily into this. These kids are addicted.
There is a silver lining for smokers. While vaping is dangerous, the research so far suggests it may not be as deadly as traditional cigarettes, which remain the leading cause of preventable death in North America. And vaping can also help users to kick the habit. In fact, studies suggest that between 15 and 20% of vapers quit smoking cigarettes. That's twice as effective as traditional nicotine gums, sprays, and patches. Bottom line, if you don't already smoke, don't vape. And even if you do, consult a doctor before making the switch. Hey, thanks for watching Global News. If you enjoyed what you saw, please like the video. And you can also hit the subscribe button on your screen to make sure that you get all the latest international news and the best trending video.